Good evening, Mrs. Boswell.
Good evening.
So I want to piggyback off of part of what Mrs. Burnett just said and what you responded to her. So you said we have currently 6 outbreaks across the entire Volusia County that have taken place in summer camps, correct?
Today.
Today. Okay. You said an outbreak is it's considered an outbreak as long as it's 2 people?
In a congregate setting.
Okay, so it could be 2 people out of a total of 5 people. It could be 2 people out of 300 students that are there, correct? So it's an outbreak if there's 2, regardless of how many people.
2 or more.
2 or more. Mm-hmm. All right. So when you were here in March, and you can correct me if I'm wrong, but when asked about the number of individuals, whether they were adults in the school setting, staff or students, if I remember correctly, you said under contact tracing, you could only trace back the possibility that 34 individuals may have come into contact with it in the school setting. And of those 34, only 4 were possibly traced back to sports, correct?
Possibly, but...
Okay. And when I asked you about what was the criteria at that time that we should have been following for sports, you read me off a list that said students should have been masked while playing sports and all of that, and we talked about the fact that none of our students were masked for sports. They played football, they played basketball, they played baseball, they did wrestling, they did all of that. Nobody was masked, and we could maybe, for the entire district, for the whole last school year, all the way from August to March, only possibly trace back 4 students, 4 individuals, so it could have been a coach, could have come into contact with it at school playing sports. Here's where I'm at tonight. I heard you make a comment about the virus is waning in older ages. So let's talk about this virus.
No, the effectiveness of the vaccine.
The effectiveness of the vaccine. So let's talk about COVID from when it started. Because COVID actually came into the United States, if you look at research, in the fall of 2018. It was approximately February of 2019 when the United States government identified principal investigative research doctors to start researching it, and companies such as Pfizer and Moderna and Johnson & Johnson started on a vaccine. My question to you tonight, I have a lot of questions for you, so I apologize, Ms. Cuthbert, but please bear with me, okay? My first question to you tonight is, here in DeLand, we have our own clinical research facility. We have 2 certified principal investigative research doctors that are involved with that. They started researching this in February of 2019. I have been in direct contact with them from the time we sent students home that spring break for, in March. I have had long conversations with them. I have seen the research that they've done. My question to you is, have you spoken to any of the doctors or researchers involved here in DeLand locally? They were selected as the first group out of Florida to do the research on COVID and to administer the Pfizer and Moderna shots. They are now doing the antibodies. Have you had any communication with them?
No.
Okay. So, can you describe for me the difference in symptoms and what happened to an individual that contracted the original COVID versus the UK COVID versus the Delta variant? Do you know the difference in the symptoms or what it did to individuals' bodies?
It depends on the individual.
Okay, do you know any of the signs, though, of the original COVID and what it did?
The symptoms that people, they were coughing, sneezing, sore throats, headaches, fatigue, diarrhea.
Okay. When people were first hospitalized with that, what was the immediate response that most hospitals, what did they do first?
They had difficulty breathing, so they were looking at the oxygen levels.
Okay. And what did they kind of jump to if they were struggling with breathing?
Well, incubating in the vent.
Okay. So research on venting individuals, whenever you go to the point that you vent someone, you basically have reached a point where a ventilator is going to harden their lungs, and it's not necessarily going to make it better. I happen to have spoken also with local respiratory therapists, as well as some respiratory therapists, actually a head of respiratory therapy out of another state. And this is what they said to me. The first inclination of what we were told was to vent people. What we quickly learned is that in the original virus, the mucus was heavy and thick. And by venting someone, you basically were pushing them to the point that they may not recover because of what a ventilator does, and also because that heavy, thick mucus then blocked their lungs and made it difficult to breathe. So what they quickly learned, and why we took a turnaround and then stopped seeing as much ventilating going on, was they learned you've got to thin the mucus out and keep it going and not vent, and that's how we turn people around. What do you know about the symptoms right now for the UK variant or the Delta variant?
They tend to be more severe. So people, the Delta, they're going into the hospital much more sicker.
That's interesting, because in speaking with these research doctors that are local here, what they've said to me is they tend to mirror a cold or a sinus infection. The mucus is not as heavy in the Delta variant at this time as what it was in the original variant, because it's a mutated piece. It's no different than when the flu mutates. Like all of a sudden we'll get a very bad flu virus one year, and then the next few years we've got mutated viruses off of that are never as strong. They're always weaker. And you realize they build the flu vaccine each year off of the variant from that year and give it to people for the next year, not knowing what the variant's going to be. So here's where I'm at on this. We already chose for masks to be optional. I'm not changing my mind because, number one, children do not belong to us. We may have children. I have children. I have grandchildren, okay? But the medical decisions for my own children when they were of school age and for my grandchildren at this time belong to the right of their parents. Parents, I'm not in the position to make medical decisions and to enforce medical decisions upon children. So by making masks optional, we've given every parent out there, every staff member, and every student the right to make the choice that is best for them. So I'm standing by that. American Academy of Pediatrics, who's their number one funder? Do you know?
No.
Let's try Pfizer. So here's what I've learned. Didn't want to get into all of this, but I've learned, and I'm researching, and I'm continuing to ask questions of those people that are dealing with this and tracking this on a daily basis. What I want to ask you about is, not once does anybody ever talk about antibodies. Do you know where we stand with the individuals that have already had COVID and where their antibodies are?
There is some CDC information out there, that's my source, that is suggesting that over time your immunity may wane if you've had a prior infection, and there are cases where people have been infected for a second time.
Okay, so, all right, you opened that. So yes, I happen to have talked to the researchers that are local here that have been tracking people since February of 2019 who got the original case of COVID. We are now a year and a half out, and those individuals still have antibodies. I have personally a 78-year-old mother and a 79-year-old father who last August got COVID, and I have their permission to share this information tonight. They have been tested 4 times since then, checking their antibodies, and their antibodies are still strong. So what has their doctor told them? There is no need for you to take the vaccine because the vaccine's not going to give you anything that you already don't have naturally in your body. So how come we're never talking about the people that have already experienced it and the antibodies that they have? Like, there's no discussion about antibodies. And I'm sorry, but naturally, antibodies, I'd much rather have antibodies because I took it. I mean, why do we draw people's blood at other times to make sure they still have antibodies to if they'd had chicken pox or if they took the MMR? We don't automatically demand everybody be vaccinated. We draw their blood to find out what they still have. So when you said the vaccinate is waning in the older, who was the first group that we vaccinated here?
Our older folks.
Okay, so explain waning.
So there is some evidence that the immunity of some of our older adults may wane from the vaccine, and they may not have the level of protection, and that's the discussion that's happening around boosters right now.
Okay, so let's go back to this. Do you have any research that shows that if you, because you talked also at one point about one shot of the vaccination, where we know if it's Pfizer or Moderna, it takes 2 shots. Only J&J, Johnson & Johnson, is a 1 shot. Do you have any research or data that tells you if everyone that was vaccinated, whether they took the Johnson & Johnson, the first shot of Pfizer or Moderna, or both shots, did they all develop antibodies?
Do I have that for the people that we vaccinated? No, I don't have that, but that's what you're expecting.
You're expecting.
Sure.
Would you like to know what the real numbers are? Nationwide, for the research that's being done in every state that is fed into one database, shows actually that everyone that was fully vaccinated, approximately 15% of them develop no antibodies. But yet, if they are carrying around a card and says they're vaccinated, we're good to go, right? But if we've had COVID and we have antibodies, whether we're 6 months out or a year and a half, we don't want to talk about it. We want you to take the vaccine. Okay, do you know what the research says right now for how long the antibodies are lasting in the individuals that have been vaccinated?
No.
3 months for some, 6 months for others, and they're still following on. All right, my question here to you tonight, because obviously, you're going to quote the CDC guidelines. I'm doing research, I'm asking questions, and I'm getting the research directly from people following all of this. When we were still in school, we had precautions. And you know what I think of the masks, because at the elementary level, some of those masks were absolutely filthy that those children were wearing. Now let me go back and ask another question. Do you know what the numbers are in the 0 to 19 or 0 to 25 age category of children this past year that lost their life due to pneumonia, not COVID-19, pneumonia?
No, I don't have that with me.
Okay, so I have it, and I can share it with you and email it to you. It's a whole lot more than what your COVID numbers are. More children died this past year of pneumonia. In previous years, more children have died of flu than they have of COVID. How many children have died in Volusia County of COVID?
None.
None, correct. What's happening right now? Let's think about this. We've been an open state, and the entire world's been coming to Florida to summer vacation. Our beaches are full, our amusement parks are full, families are here together because they can be here together and there's no restrictions. Kids are at summer camps, kids are going to youth camps, kids are hanging out. And guess what kids are doing? Because this is what children do. Children hug, they touch each other, they hold each other's hands. We got teenagers out there kissing. Teenagers were kissing even during the school year when we made them wear a mask, but trust me, they took it off and they were kissing. But kids during the summer share food. Mom cuts up a watermelon, sticks it in a bowl, and they all reach in and touch it, and they share food. They share drinks. I mean, I got a 2-year-old and 4-year-old. The 2-year-old picks up the 4-year-old's cup all the time, thinking he has something better to drink than what she has, and he takes a drink out of it. Right now, we're not comparing apples to apples. So my next question for you is this. The numbers that you sent in the report over to Dr. Fritz and said, here's where our positivity rate is. The way you calculate the positivity rate, and I'm going to make it just very simple, is, so if last year we had 1,000 people, like this week in July, that were tested, and 50 of them were positive, that's how you calculate your positivity rate. Well, if this week in July, this year, only 100 take the test, and still 40 of them show up, all of a sudden our positivity rate's way up here because a lot less people got tested. Because that's how you calculate positivity rate. So positivity rates don't mean anything. What means something is, last year, if you say to me, last year on this date, Ms. Haynes, there were 72 positive cases, positive, people that tested positive, and you tell me there's 172 this year, then yeah, I've got to wake up and look. But your positivity rates are based on how many people test versus how many test positive. Less people are testing. And we've also talked about them having to test and retest and retest. And look, I appreciate what you do, but the bottom line is, if we've got right here in DeLand doctors that have been researching this and involved with updating the research, and they're tracking people for 3 years right now. Because remember, this is still not approved. This is still under an emergency order, okay? Why is it still under an emergency order? Because we don't have enough data on it. We don't know the long-term side effects. We don't know how long will you get antibodies? How long will your antibodies last? Now, I can tell you, if you got it, if you've already had COVID, you're truly in better shape than anybody else because you've got antibodies.
Except for the 907 individuals who've lost their lives.
Okay, I don't want anyone to lose their life, but the reality is every day someone loses their life. People lose their life due to cancer. People lose their life due to so many contributing or comorbidity factors. We don't live a single day that someone doesn't lose their life. Answer by saying that, were the flu deaths larger than what COVID's been?
Not this past year.
Okay, no. The year before, were they larger than what?
Yeah,
because we're labeling everything COVID that we can label COVID because there's money attached to it. So were the flu deaths the year previous to COVID coming out higher than the COVID deaths?
I don't have that number with me.
They were higher. And I'm telling you that this year alone, the deaths to pneumonia were higher. And you know what strikes me interesting about pneumonia? I had pneumonia 6 years ago. It was one of the worst things that I lived through. But here's what's interesting. Nobody said I had to take the pneumonia shot. Nobody said, you've had pneumonia, or wait, all of us could get pneumonia. You've got to take the pneumonia shot because you're not going to live through pneumonia. So thank you very much. Thank you for coming. Thank you for being gracious and kind. Thank you for answering my questions. But when this all started, we were told, stay home. Stay home, don't go out, don't talk to anybody, don't have contact, don't hug anybody, don't kiss anybody, and we'll flatten the curve if we stayed home. Well, we stayed home and we didn't flatten the curve. Then we were told, now you all need to mask up, stay 6 feet away, quarantine, all that. We didn't do it. Last year, one of my schools quarantined the entire 7th grade twice because you told them to. And each time you told them, they had to send every 7th grade child home from that school. The first time was 14 days. The next time was 10 days. It was due to an adult that, and if you remember, at least I remember, when we started this process, you said, if you put them in seating charts and they wear masks, and no one that tests positive is in their space less than 3 feet for 15 minutes, longer than 15 minutes, those kids won't have to quarantine. Well, my question was this. Typically, a 7th grade class period lasts 45 minutes. So I really struggled with how a single teacher in that room, because I went to the rooms, with the kids spread out, sitting behind plexiglass shields, wearing masks, that the entire 7th grade had to go home, because I couldn't figure out how that teacher, and before it was, if they had masks off, I couldn't figure out how that teacher spent 15 minutes or more in close proximity to every one of those kids. And I followed up, and not a single one of those children ever got sick during both of those times. So they missed 24 days of instruction. Prior to this past year, when a kid misses 5 days, parents are given a warning. When a student hits 10, they're given the second warning. At 15 days, they receive a letter stating they may have to appear before a judge because their child's not in school. No, I'm not accepting responsibilities. You and your team sent some of our kids home last year, and they missed 40 to 48 days of school. We're not under an emergency order anymore. In my opinion, if they're out 5, they're going to get notified. If they're out 10, they're going to get a warning. At 15, they're getting a letter home. So how can we be the ones sending them home? What I want to say to parents is this, as we've always done. If your child is sick, please do not send them to school. If you, as an adult, work in a school system, please do not come to work sick, okay? I believe if we do that, if we continue to say, you want to wear a mask, you want to wear a mask and a face shield, please do so. As long as we continue to stock soap, paper towels, hand sanitizer, and we continue on the path that we've done with these kids about washing their hands, not touching their face, not putting their fingers in their mouth. If we continue on the path of them not sharing food, not sharing drinks, wiping off their desk area, wiping off tables where they've been, we're going to be fine. And if they get sick, they're going to go home. Because you just told me, we've not lost a child, which is a blessing. Because I've never known a year that we've not lost a child to something. Because we've lost children in so many things. So thank you for coming tonight, but I'd like to suggest you may want to reach out to our local research facility that's here in DeLand and have some conversations with medical doctors that not only have medical degrees and practice as doctors, but they've gone on and taken the additional coursework and everything to be certified to be principal investigative research doctors, and they've been doing research now for probably a minimum of 15 to 20 years. They're located here in DeLand, and they are a part of this nationwide project doing all of this research, and they have access nationwide to tell you where we're at. And the last time I spoke to one of them, they said, actually, nationwide, we've had less than 600 children. And when I say children, I have to preface the age they told me, 0 to 24, okay? Mm-hmm. And let me tell you, what young 20-year-olds are doing is a whole different thing than what little people are doing, all right? That have died where it has been coded as COVID as part of one of the things. But when you break it down, you have to look at the comorbidities and what contributed to that, because there's not very many, if any, that can be strictly a straight COVID death. Thank you.
Thank you.
Thank you, Ms. Haynes. That will not, I'm sorry, I asked you